Hello, today we are going to discuss about the answers along with the explanations of the MCQ test of chemotherapy 2, which includes systemic chemotherapy. And the first question is, which is the preferred agent for the radical cure of P. vivax malaria? Okay, now you all know that in P. falciparum malaria, there is no exoerythrocytic phase. So there is no need of giving the agent that will cause radical cure, but which is not true in case of P. vivax malaria, and we require an agent which is that's on this exoerythrocytic phase or the hypnozoids for the prevention of recurrence. And there are different drugs which are acting on the different phases. Some drugs are acting on the pre-erythrocytic phase, some acting on the erythrocytic phase, some acting on the hypnozoids, and some acting on the gametes. Here the options are artesunate, then artesunate plus sulfadoxine plus pyrimethamine, that is ACT, then primaquine and mefloquine. Now the primaquine is the agent which is primarily acting on this exoerythrocytic phase as well as for the gametes. So here the correct answer is primaquine. Now if someone asks you that what is the role of the primaquine in P. falciparum malaria, in P. falciparum malaria, primaquine is used as a gametocidal agent. Now rationale behind the artemisinin based combination therapy is, now you all know that now the artemisinin derivative, they are the drug of choice in case of the P. falciparum malaria, especially in India, because the majority of the strains they have developed the resistance. But these artemisinin derivatives, they are not used alone, they are used as a combination therapy. Okay, now what can be the reason? The options are quick difference. It means that the improvement in the clinical symptoms is very quick. Second is to decrease the incidence of adverse effect. Third is to prevent the development of the resistance. Fourth, to broaden the spectrum of anti-malarial action, and E, all of the above. Now if you just look at the options, each option has some advantage, so by mistake you can select the E, all of the above. But dear friends, the purpose of the ACT is that artemisinin derivatives, they are presently very effective, but we are having no other option. If there is a development of the resistance, presently we are not having any other agents which can act on the P. falciparum malaria. So to prevent the development of the resistance, we are giving this agent in combination with another agent which is a longer acting. Okay, so the correct answer is to prevent the development of resistance. Now match the followings. Here the different classes are given of the anti-HIV drugs, that are integrase inhibitor, fusion inhibitor, protease inhibitor and CCR5 inhibitor, and the options available are maraviroc, raltegravir, enfuvirtide, ritonavir and acyclovir. Now integrase inhibitor, that is the first agent that is developed in this group, is the raltegravir. Fusion inhibitor, that is enfuvirtide. Protease inhibitor or vir, like ritonavir, indinavir and all that, but not acyclovir. Okay, and the CCR5 inhibitor, that is maraviroc. Okay, this will again help you to remember the classification of the drugs acting against HIV virus. Now again match the followings. There are different adverse effects of the anti-tubercular drugs are given, like orange discoloration of the urine, peripheral neuropathy, loss of visual acuity and hyperuricemia. And the options are pyrazinamide, rifampicin, isoniazid and ethambutol. Now rifampicin, it will lead to the orange discoloration of all the secretions, and prior information should be given to the patient. Even though it is not harmful, but it has to be informed to the patient prior giving the therapy. Peripheral neuropathy, it is a common adverse effect of isoniazid which can be prevented by giving pyridoxine. It is also used for the treatment. Loss of the visual acuity in case of ethambutol, and that's why it is not possible to identify these adverse effects early. in the pediatric age group. That's why it is contraindicated before the age of 5 years. And hyperuricemia, it is most common with the pyrazinamide. Okay. Now sulfonamide, which is used in the fixed dose combination for the treatment of malaria. Now you all know that the sulfonamide is only used topically nowadays. It is not used alone for the systemic therapy because of the reason of the development of resistance. And here in case of the malaria, we require a sulfonamide which matches the half-life to that of the pyrimethamine, and we require a long-acting sulfonamide, and that is, here there are 4 options: sulfadoxine, sulfamethoxazole, sulfadiazine and sulfacetamide sodium, and the answer will be sulfadoxine. Sulfamethoxazole, sulfadiazine, sulfacetamide sodium, they are not the correct option. Fluoroquinolone, having poor activity against Mycobacterium leprae, is, you know that the fluoroquinolones like ofloxacin, pafloxacin, sparfloxacin, moxifloxacins, they are very effective against the Mycobacterium leprae, but somehow the efficacy of the ciprofloxacin against Mycobacterium leprae is very less. So here the answer is ciprofloxacin. Antifungal agents acts by inhibiting the synthesis of beta-1,3-glucan is, now beta-1,3-glucan is a component of the fungal cell wall. It is a very important component of the bacterial cell wall. If you can inhibit the synthesis of this, there is no further synthesis of the fungal cell wall and there is an immediate fungicidal action. And the options are amphotericin B, caspofungin, iconazole and griseofulvin. Amphotericin B also inhibits the fungal cell wall, but it binds with the ergosterol and it produces the micropore, so it is not the correct answer. Iconazole, it is an azole group of the drug which acts by inhibiting the fungal cell wall by inhibiting the lanosterol 14 demethylase enzyme, and the griseofulvin acts by inhibiting the mitosis. But caspofungin, it is the correct option. It inhibits the synthesis of the fungal cell wall, but by acting on the unique pathway by inhibiting the synthesis of beta-1,3-glucan, and so the answer is caspofungin. Which of the following drug is used as a single dose therapy for treatment of roundworm infestation? For the roundworm infestations, we are having various agents: mebendazole, albendazole, pyrantyl pamoate, piperazine, but the first line agent is mebendazole, albendazole and pyrantyl pamoate. But whenever we are talking about the single dose therapy, then the answer will be albendazole 400 mg single dose. Obviously the ketoconazole, it is not an anti-helminthic drug. Mebendazole, it is effective, but the dose is 100 mg twice a day for 3 days. So the correct option is albendazole. Chloroquine is used in following conditions except rheumatoid arthritis, gout, extraintestinal amoebiasis, lepra reaction and all of the above. We go one by one. Rheumatoid arthritis, yes, it is having a significant action to prevent the disease progression in rheumatoid arthritis. Extraintestinal amoebiasis, yes, it acts on the hepatic phases and that's why in hepatic amoebiasis it is preferred. Lepra reaction, it is helpful, but it is not at all helpful in the case of the gout, neither in the acute nor in the chronic phase of the gout. So the correct answer is B, gout. Drug of choice for the herpes simplex encephalitis is, so the answer is an antiviral drug. Here the options are acyclovir, ritonavir, zanamivir and rimantadine. And here it is very easy because acyclovir is the drug of choice in case of herpes simplex encephalitis. Other options are incorrect. Following are the antimetabolites used as anti-cancer agents except, now antimetabolites are also used, one of the important drug group. They are either folate antagonist, purine antagonist or pyrimidine antagonist. Methotrexate is a folate antagonist. Azathioprine and 6-mercaptopurine, they are also purine and pyrimidine antagonist, but cisplatin is a platinum compound, not an antimetabolite, so the answer is cisplatin.
Duration of the treatment of multibacillary leprosy is, leprosy has been classified for the treatment, for the selection of the agent as well as for the duration of the treatment into the paucibacillary leprosy and multibacillary leprosy. Paucibacillary leprosy, the treatment is of 6 months, while in case of the multibacillary leprosy, the treatment duration is of 12 months. So the correct option is 12 months. Antifungal agent used orally as well as topically. You know that there are many antifungal agents, they are used exclusively topically. There are many agents which are exclusively used systemically, either oral or intravenous, but there are some agents which are used both. And here the options, if you can look carefully, they are all the azole derivatives: ketoconazole, fluconazole, clotrimazole and amphotericin B. Now you might select, okay, the D is a totally different group of agent, that's why you may select D, but it is not always true. Amphotericin B is the systemically used antifungal agent, while out of the first three, ketoconazole, fluconazole and clotrimazole, ketoconazole is used both topically as well as systemically. Fluconazole exclusively systemically by the oral route, clotrimazole topically. Okay, so the answer is ketoconazole. Preferred agent for killing the trophozoites in the intestinal lumen for asymptomatic cyst passers is, and the options are metronidazole, diloxanide furoate, then chloroquine and paromomycin. Now here our aim is, in the asymptomatic cyst passers we have to kill the trophozoites in the intestinal lumen. Okay, and to prevent the development of the disease, we require only luminal amebicide. So metronidazole is out of question because it is having both of these actions, luminal and extraluminal. Diloxanide furoate is a correct option. Chloroquine out of question because it is only acts on the tissue level. And paromomycin, yes, it can also be used as a killing of the trophozoites because it is neither absorbed nor secreted and it acts locally in the intestinal lumen. But according to the many guidelines, the diloxanide furoate 500 mg 3 times a day for 5 to 10 days is the preferred agent. But dear friends, if you write paromomycin, still it is not wrong. So here is the answer, that is diloxanide furoate. This is all about the chemotherapy MCQs along with its explanations. Thank you very much.